I want to welcome everyone to Connect Safely Live. Our very special guest today is Dr. Enoch Choi, who is a frontline COVID-19 physician. He's working at the county hospital, I think mostly with low-income patients, doing an amazing job. This is in Santa Clara County, which many of you know was at one point one of the nation's biggest hotspots, although Enoch can talk a little bit about how well we're controlling it. I believe we're doing a reasonably good job now. But before I bring on Enoch, I want to acknowledge my co-host, Kerry Gallagher. Hi, Kerry.
Hi, Larry. We should specify Santa Clara County in California, right? Because we're on nationwide. So
that's right.
We want to make sure folks know where we are. Yeah, absolutely.
Santa Clara, well, although Santa Clara County did get world famous because of our initial outbreaks. Enoch Choi, welcome to Connect Safely Live.
Thank you. Really appreciate you having me. And I'm really glad to be speaking with an old friend and a new friend. I'm here speaking personally on behalf of myself, my own personal views, and not on behalf of my employers, the county hospital, or our Team Health, which has the subcontract for the care that we provide.
I should note, by the way, that Enoch is not only my friend, but at times when he was the urgent care doctor at Palo Alto Medical, he was occasionally my physician. And I can say that our low-income population is in extremely good hands with Enoch. He left what I'm sure was a lucrative corporate practice for doing something for the public good. And I'm very proud of him and pleased that our community benefits from him. And really more than the community, because this isn't the only podcast or webcast that I've seen him on. He's done a lot of work nationally and internationally. Enoch, I don't even know where to begin. There are so many questions I want to ask you, but let's start with the COVID-19 question about how things are going both locally, but more important, nationally, since we have a national audience.
Locally, I'm so encouraged. People have taken to heart our county health officers' encouragement to shelter in place and to only stay with your family members. They have really not only flattened, but really squashed, completely squashed the curve. We've had a slight increase this past week with some people who may have met with their mothers and gone out in order to prepare for this kind of celebrations. We are concerned that as the shelter in place is lifted, we're entering stage 2 in the majority of the counties in our state, California. And we're expecting people to be able to now receive goods at the corner outside the shops as those stores return. But even more concerningly, starting in June, we expect that even companies and businesses that have the ability to possibly need to share intimate airspace, such as hairstylists and salons and barbers and other personal services, also gyms and other places that possibly will reopen, places that we may actually share airspace in a closed space and may not be able to keep that 6 feet distance. There is concern that there could be increased transmission and concerns whether or not we have the ability to do testing and contact tracing for all the new cases that we'll have. Although currently we're really very encouraged. The reason why we're concerned is that in places that have reopened, both domestically and internationally, there's been rates of spread. For example, in Germany, a few days ago, after being open, they returned to exponential spread of COVID, and Chancellor Merkel asked people to not meet more than two at a time, they and the person you're speaking with, just to try and reduce that exponential spread. So we're concerned that a similar kind of thing would happen here in the States as we return to opening up.
I'm glad you raised that issue, because I'm very concerned both about the opening up, but the information that it's based on. So for example, I haven't verified this personally, but I did see an article, I think it was the New York Times today, someone claiming that Georgia literally was faking their numbers by showing the new incidents not in chronological order, showing a curve of how it's going down, but they weren't actually literally in chronological order. They were picking dates out, so conveniently. If that's true, I just can't even begin to fathom it. And, we don't get political at Connect Safely. We're a nonpartisan organization. But the fact is that some information's come out of the White House. I mean, as recently as yesterday when we found out the president claims to be taking a drug which almost every physician I've heard from says is dangerous, especially for somebody who's overweight, elderly as he is, and has a very high stress job. Yet millions of people heard him say that, and some percentage of them are probably going to follow his advice. So we have you on because we know you're only going to give good advice, but what about all the misinformation that's out there?
So the misinformation will come out eventually. Oh, I think that's me. 1 second. Let me get off of the phone.
No worries.
Totally
no worries,
forgivable
Enoch.
in your case. And
Yeah,
if it's
absolutely.
an urgent emergency, take the call.
No, it's the hotel staff, I think. So
okay.
I'm in a hotel for the last 2 months to try and protect my family from having COVID from asymptomatic spread from me. I've tested repeatedly negative, but I'm at a hotel. 2 things there I wanted to address. Both, Larry, that you are concerned about misinformation. Misinformation will come to light that it is false. For example, in China, they claim a certain number of people affected, and but then the number of people who passed away and died was much higher than that. So there's a discrepancy in the number of deaths versus the number of claimed cases, and you can draw your own conclusions. Similarly, here domestically, we'll have to compare things that cannot be faked from information that is meant to mislead the public. And so it's important that people who have reliable sources of information help the public understand what is true and not. In terms of false claims of benefit of certain medications, hydroxychloroquine and chloroquine, the medicines that are in a dispute, have been only used in the very sick, intubated people in the hospital who are need a Hail Mary to possibly be saved from dying. And it's not recommended for the average American, anyone who's not in the hospital dying. And so until we have more clear evidence that certain medications are beneficial when you're less sick, I would follow the guidelines of the FDA and of national organizations stating that it hasn't proven that there's benefit. There are some medicines that have proven benefit, and remdesivir has been FDA approved on emergency use for people to be used to receive it. Again, there's so little of it that it's being used in the hospital. So I would, in this time of confusion and misinformation, I would ask you to trust your physicians and the national organizations that are speaking, rather than people who have a political benefit of reassuring people by helping them feel falsely secure in opening up and returning to being with other people.
I know Kerry has a follow-up question, but I just want to ask a quick follow-up question. I'm sure what you're saying about any of these dangerous drugs is absolutely true, but what about relatively benign things which may or may not work, but are not really known to harm you, like some zinc or vitamin C or other over-the-counter things that some people are taking?
You know, people believe that some of these over-the-counter things have relatively little harm, and they're right. Some people, unfortunately, take it to extremes. And if you take more than 3 grams of vitamin C a day without drinking enough water,
right, you
can get the kidney stones that you are developing because you're not allowing the vitamin C to be urinated out of your body. So there's certainly low levels of medicines that can be taken over the counter that are possibly of benefit. I would again follow the national guidelines from FDA and the CDC and other folks that have shown whether or not those things would be beneficial or not.
But that zinc lozenge I took this morning probably won't hurt me. Well, it might not help me, but it probably won't hurt me.
Right.
Yeah. Kerry?
So I have a follow-up question for you, Enoch. There are a lot of sources of really helpful information, and I really appreciate you funneling us towards the FDA and CDC. But obviously, locally, and depending on the size of our states, you all are in California, and so that's a very big state. I'm in Massachusetts, which is a very small state. So community guidelines from town to town or county to county aren't really that different because Massachusetts is so small here. So we look to our state. You know, why is it important, in addition to following federal guidelines, for folks to really pay attention to local guidelines? And who should they look to find those local guidelines?
Your local guidelines here where we are in Santa Clara are frequent. You'll have postings every day about a different topic, twice weekly on Facebook Live. There's clarifications such as yesterday regarding our county being the last to join stage 2 and starting to reopen. And so your county health officer is the one who provides the state with what is the restrictions needed in our area and what are we seeing locally. It will probably be the most reassuring to you to know what's the status where you are and trustworthy information regarding what you can do. And you can also ask your physician. Your doctor hopefully would give you the information that is based on national organizations. If your physician is board certified, most physicians are, and your national boards don't spread misinformation. They really try to rely on reliable information. So if you can find out if you can't find answers from your own physician, from the county, then I would go to the national organizations and look on their websites and see what they're saying about things.
That's great. I have one follow-up question for you. A lot of people are trying to be helpful by sharing information they find online on their social media feeds, right? And one of the things that we talk about at Connect Safely is that, you know, it may be impossible to stop people from sharing false information, but one thing that we can do is drown out the bad or the false with the good. That's one thing that everyday people can feel empowered to do. So, you know, I think, have you as a doctor shared some of this information? And, you know, how can we try to make the positive stuff go viral, I guess, online as much as possible as everyday citizens?
You know, in every time I've had a couple of these broadcasts now, and I've tried to reassure people that America's, in many places like ours, is doing really well, and the people who are able to shelter in place and obey the recommendations, you're going to be fine. I want to reassure people that if you can limit your exposures, you'll be fine. And if you do get sick, I want to reassure them that our health institutions are not overwhelmed. We're not in New York City, Detroit, New Orleans, where there are very overwhelmed health systems. So some places in the country, that is unfortunately the case. But where we are in California, we've fortunately have a health system that's able to respond to you and help.
And since we do have a national audience, I would urge people to check with their local health authorities to see what applies to them, because I think most of the country, correct me if I'm wrong, is in pretty good shape, except for a few very bad isolated hotspots. Is that correct?
That's correct, yes. And so what I try to share online is to say that you can follow the instructions, be reassured that people are there to help you if you do get sick. And in this time where people are staying home, to be gentle with yourself, take care of yourself, do the things that help you feel good about being with family, connecting with them, talking about your fears with them, getting reassurance and care and love from them. And if you see things that are not right, if you find that there are things that are going wrong that make you feel not safe, reaching out to people that you trust to share those concerns, whether it be that you're worried that a child is being abused, or if a partner of one of your friends is being abused. There are resources out there, and people would like to be able to help. So it's a time at which, since we're sheltering in place, many of those things are going unreported. And the people who are usually able to point those out, for example, teachers and principals, can see unusual marks, or your physician who could see you in person and see those unusual marks and point it out to authorities. We're unable to be that that voice of protection to help these individuals. So if you at home see the same things, to speak out and to say, hey, are you okay? Do you feel safe? Are you safe where you are? Do you feel safe with the people you're with?
Those are really great points. Just because we're undergoing this unprecedented pandemic doesn't mean other potential dangers or issues are not cropping up at home, like children cropping up at home unexpectedly right here. We have a question from our audience, and before I ask this, I want to make sure we do encourage our audience to share your questions with us via the Zoom Q&A feature so that we can ask our doctor guest here. The first question is from Jeanette Ocampo, and she's asking, how effective are the antibody tests that we're hearing about?
The only reliable tests that we have currently are those that are based on antigen, PCR, detecting the RNA of the virus. Antibody tests are not reliable. The difference is that the PCR nasal swab testing whether or not the virus is present in your body currently tells you whether or not you're infected and able to spread it to other people. The antibody tests are for IgG antibody or IgM antibody. IgM antibody rises quickly within a week of your infection and stays only as long as you're currently infected. It drops quickly. IgM antibody is the way that your body protects you, and it gives you the ability to have some reassurance that for a short period of time at least that you are protected from this illness. The reason why we find those tests to be unreliable is that they perform poorly currently at a low prevalence of disease in the population, meaning that there's not enough disease, not a high enough percentage of people ill for it to have a accuracy. It needs to have enough people with the disease to be more accurate. And we don't understand the disease well currently. The IgG titers in some people drop quickly, sometimes within weeks of testing positive. And then we're not sure if when they test negative for IgG, whether or not they've lost protection. In other diseases, such as measles, we've seen that your titers drop and then you're unprotected and that leads to outbreaks. We're concerned that that's the case. A lot of evidence points against that the evidence does point to the point that we actually do retain the ability to start making the IgG again if we're challenged with this virus, and that we hopefully do not have the possibility of reinfection, that we instead have retained the memory in our memory B cells to make that IgG again to protect us. But we just don't know enough right now. That's why we don't believe that the antibody tests are accurate or reliable.
This is the kind of detailed information you rarely get from the media, so thank you very much. We do have another question. Before I read it, I want to remind you that in addition to asking a question on Zoom, if you're watching live, and by the way, live meaning somewhere between 10 and 11 o'clock Pacific time on Tuesday, if you are on Facebook, you can use the comment section to ask a question, and we'll get that as well. But our question right now is from, I'm not sure I pronounce that, I think it's Ufer, if I'm pronouncing it. What would it take for large gathering or travel to start again? Would we need extra testing or almost real-time testing?
Real-time testing is the golden, what we really would love to have. There's some tests available. We use them in the emergency room. The White House uses the Abbott test, which gives you results within 15 minutes. The sacrifice we make for rapid testing is accuracy. And so there's some concern that the White House is not using the most accurate test available for rapid testing, or whether or not the White House should be using a less accurate rapid test, and maybe they should really be using a more accurate, slower test, given the importance, the incredible importance that they serve us in national leadership. And my concern is that the only reason to use a less accurate test is to reassure the public that they're using the same test that is most commonly available, which I think is flawed rationale. We do absolutely need an accurate rapid test. it's going to be essential for places such as the TSA checkpoints at airplanes, checkpoints at maybe large arenas that want to be able to let in a certain number of people that socially distance at a safe distance to watch a sporting event with a lot of people, whatever, possibly churches or other places that people want to congregate safely, rather than some of the behavior we've seen with people returning to getting together. And I'm a person of faith. I fully support people worshiping together. But if you look at the example of the Washington State Choir that early in our infection spread it to everyone, 58 out of the 60 choir members when they're practicing together, even not just meeting together to worship. And then you look at the Korean examples of churches that there's a very large cult that was the main spreader of illness. And it's sad to think that we're unable to practice our faith in the way that we did before. But for the purposes of public safety, we need to follow the directions of our county officers, and that will keep us safe and not spread the disease as rapidly and exponentially as it has in other places.
And just to be equal opportunity, the Jewish Hasidic Orthodox synagogue in New York also had a spread earlier in the epidemic. You know, I wanted to comment for a moment on the way you spoke a few minutes ago about reassuring people, not that things will necessarily be okay, but that if you do the right things, chances are you're going to be okay. Because, you know, a lot of what we're dealing with, I mean, FDR said the only thing we have to fear is fear itself. Well, we have things to fear besides fear. But fear is a debilitating emotion, and I know it affects me. I mean, I wish I could tell you I were immune to it and that I didn't have moments when I started spiraling, and I do. And one of the things that I've tried to do is limit my media exposure. As you know, Enoch, I'm a news junkie. If I had my way, I'd be watching cable news 24/7. But I don't right now.
No, Larry, none of us know that about you.
But you know what I'm saying? It's like I really have to really limit it to maybe at most an hour a day, if that. And sometimes I turn it off because I'm sort of rehearing news I already know, and all it's doing is re-stimulating that fear emotion in me.
You know, there was a period of time once we entered this pandemic that I stopped listening to my usual, you know, I'm a news hound as well. I love following what's current. And I stopped and I just started to listen to encouraging. I'm really into musical theater, so I just listen to lots of Broadway. But I've recently returned to listening to the news, and I just select really specific national sources that are reliable: NPR, New York Times, podcasts, ones that I know will not be sensationalist and not spread rumors and false information. I think if you can limit it to a small amount of your time daily, I don't think it's harmful. But if you can surround yourself the rest of the day with those who you love and people who are reassuring and caring of you, I think you can temper the anxiety that listening to how bad it is in some places in the world and some places in our own country. But hopefully protect yourself by staying home and being with your family.
So here's a question. Again, this is from Emily on our audience. And this is something that I'm sure Kerry wants to know as a teacher, and my daughter as a kindergarten teacher wants to think about. Do you see it being, yes?
Larry, I actually wanted to ask a question before this one, because in terms of like chronological time, one thing that I really appreciate, you're really driving home the point, Enoch, that people should follow local guidelines at the time that they're given. And then if you do that, we should feel reassured that we're going to be okay. But I think it's impossible not to think a little bit about the future. We have an audience question about the opening of school in September, which Larry's going to ask in a moment. But I have a question about the summer, especially for those of us who have children, as you could saw children the age that I do. You know, we've joined a local pool. We, as members, they normally are getting ready to go to summer camp at this time. Our family, you know, summer vacation has been canceled. What are some things that parents can plan for the summer? Because this remote learning, obviously, whatever structure this is providing is going to be gone very soon. And I think in some parts of the country, it may already be gone. And summer is coming. What are some things, some structures that we can put in place? And again, reassure our children, like, you will be able to do this and this, but not this and this. Any recommendations or ideas would be great. I mean, I'm even thinking about camp and barbecues and seeing their friends and going to the beach or going to a pool, those kinds of things.
I think parents have to take their own children and make very specific decisions by your family, because you know your children. I'm on the board of my children's school. They've had the benefit that they're a local outpost of a China-based, Hong Kong-based organization. And so we've taken a lot of learning on how they've reopened school by having social distancing, protecting the children by having, for example, like every other child eat and not expose children within 6 feet of people breathing while you're eating, even at lunch. These kind of examples that we can take internationally are really helpful. I say, think about your own children, because some parents have children who will be very careful and not hug and kiss and be really intimate with their friends. And if your children are young enough that that's not able to be directed, then some parents may make the decision that they would choose not to meet with other families, because even when we reopen, the risk is that as we reopen, when you have that kind of intimate contact with friends and people that you vacation with, then you risk exposing yourself. So I'm thinking about that right now, because fortunately, healthcare workers, essential workers, can still have access to campgrounds and KOAs because they're used as places that we can stay. So they let us stay not just at a lovely place that the county is supporting me to help me afford this place, but also certain places are available, such as these campgrounds, or places that the government does not actually control us in using, such as Bureau of Land Management or other national park areas that are allowed to have people camp out at. So there are places that you can go even with the restrictions in place. I would still really recommend parents to be very careful. If your child is the kind that's not going to be able to keep at a safe distance from their friends, that on an ongoing basis, unfortunately, not just this summer, not just this coming fall when people are getting back to school, but I think we'll have waves of increased illness because of our inability to have enough testing and contact tracing to stop the spread of the illness. And so we're going to be in a place where we have to protect our children by knowing them and helping them protect themselves by possibly choosing not to meet with other people if they can't keep from hugging and being friendly with their buddies.
You know, I'm glad, I'm going to read Emily's question in a minute because it's a great follow-up to Kerry's, but Kerry reminded me of something that I have heard reports from credible authorities that children typically get mild reactions, that they are much less likely to have horrible consequences than certainly elderly people. But then lately I heard, and again, I'm not spreading this as a rumor, I'm actually raising it to you. I heard someone in the news say that children can't spread it to adults. And that makes very little sense to me, but I'm curious from your standpoint as a doctor, could a child, even though they're asymptomatic and going to be fine, spread it to mom or dad or grandpa or grandma?
Unfortunately, that is possible. We've seen, for example, that case of the choir member in Washington spread it, while asymptomatic, spread it to all of the other choir members. Unfortunately, people who do not have symptoms, they can be at high risk of transmitting the virus, because we see the concentration of viral particles peak the day that you start to have symptoms. And so for a number of days before that, before you had any shortness of breath, any cough, any fever, any muscle ache, any loss of taste or smell, you were possibly infectious. And so it is possible for someone without any symptoms to share it with their loved ones at home. And that's why it's so important that for now we continue to shelter in place and not have contact.
Okay. I have a question. I just want to remind people that those symptoms you read off, which can be symptoms of COVID, could also be symptoms of something else. So it doesn't mean
that's right.
You necessarily have COVID just because you have a muscle ache or coughing or whatever. So Emily wrote, do you see it being possible for elementary students to safely go back to school buildings in September, or do you think that would be unwise?
your local school district will let you know how they're keeping children safe. There are many measures that can allow the children to return safely, temperature checks, stringent hand washing. They've seen that if you wash your hands 10 times a day, it is incredibly helpful in limiting the spread of these large respiratory droplets contaminating other surfaces that you could possibly contact. Wiping down high trafficked surfaces and areas at least once a day. There's these national guidelines on how to keep places that have to have many people gather to try and keep those places safe, and they would use those kind of guidelines in reopening schools. They've done so successfully in other countries, in Asia specifically, since they were more affected earlier. So there will be guidelines. I think there will also be exemptions allowed for parents who feel that their children are at exceptional risk because of their children's illness or immunocompromise or other issues that could place them at much higher risk of a serious complication. The children who have, the very few children nationally that have suffered and even died are ones with chronic conditions and issues that would make them at higher risk. And I feel like not only those children, but other parents who feel that their children should be more protected could likely receive the allowance to ask for distance learning options as they're doing right now.
So, and I wanted to follow up with that. So as a school administrator, I wanted to reassure parents that my school has created a task force that is divided into 3 subgroups. And each of those subgroups is planning for 3 different scenarios. So are we going to be able to return to campus? Will it be more of a blended system where we can partially return to campus? Or are we going to be kind of fully remote and doing online learning? And we're not looking at each option as like, oh, this is the one that we'll do next year. We're looking at them as models that we may actually move between throughout the year, right? Depending on recommendations and how things change. So I can certainly recommend or recognize how it could be anxiety provoking as a parent to not know what the school is going to do at the start of the year. But I wanted to reassure parents that schools are already doing this planning and gathering the resources and gathering the research and communicating with each other to make sure that, you know, it isn't just your local district that's going to be doing the right thing. The neighboring ones will too, right? Because that will affect the health of your community. And, you know, we're talking with doctors like Enoch here as part of the work that we're doing to do this planning. So hopefully from an education standpoint, that also partially answers Emily's question, because it isn't just elementary age students. I mean, the groups of people that I've seen acting unwise in public have actually been mostly adolescents. And that's because they miss each other. And so it's hard to keep adolescents apart, not just young ones, right?
Yeah. So I'd like to switch gears, if I might, and talk a little bit about sort of the social consequences of this disease. And specifically, Enoch, I know this is something that you have direct concerns over and possibly experience with, which is discrimination based on race. Certainly, Asian Americans have been targeted because, I presume, because of the fact that this may have come from Wuhan, but also African Americans in some cases have been targeted, and in many cases are getting the brunt of the disease in certainly certain communities. So talk about both the human form of discrimination and then indirectly how social conditions affect different groups, cause the virus to impact different groups differently.
I care really deeply about this. It broke my heart that as people conflated the source of the disease having come from China, they conflated that with people here locally who, many of whom were born and have been here for possibly generations, and could be more American than many of the people who are discriminated against them, that they suffered, people here, Asian Americans, Chinese Americans suffered violence. The FBI opened investigations into hate crimes against Asians just because we look like many of the initial people who were infected. And it broke my heart to hear that people were stabbed, shot, beat up on public transportation, on the open street. So many were spat on. My own colleagues, many physicians actually started a campaign to share how they had been in public harassed, attacked, spat on because people in the public believe that people who look Asian are the cause of their suffering. And it's not that I don't empathize with people's suffering that drives them to that. I understand that people are without work, that they are under extreme economic and feelings of threat of losing their homes after losing their jobs, feeling that there's what's the purpose, what's the reason to continue to live. And I am so sad for them, but I just beg them not to take it out and to take it out on people who happen to look like the people this disease came from. It doesn't make any sense to me that you would attack somebody who's trying to help you. For example, my own fellow physicians and nurses. In our area, the majority of the workforce who's trying to help you in terms of your health happen to be from this ethnicity. For you to attack those people just lessens your likelihood that will be available to you to help when you get sick. And so I'm so sad that this is happening, and why I've shared extensively online against this by telling them, you know, we are probably some of the least likely people to infect you because there's much higher rates of wearing masks, of wearing the proper protections, and obeying the law, obeying the instructions for people to congregate. And because of that, we're much less likely to be infected. So for you to spit on us or attack us is a very misguided. They just don't understand that we're probably less likely to infect them, even if you had intimate contact with us.
And let's talk about other communities too. As we mentioned earlier, you're working in a clinic that primarily sees low-income people, and we have seen that the traditional divisions in our society seem to be playing out in infection and death rates as well. And I was wondering if you could talk a little bit about kind of this sort of the socioeconomic aspect of COVID.
You know, I work in a clinic that allows people without income, without insurance, without even citizenship, so undocumented. Anyone could come in and get care from me. I'm very thankful I'm in that kind of a location. It's opened my eyes to how much more discrimination there is when I hear their stories, many from minority groups, African American and Latino groups, where they've suffered even much more discrimination than they had before. Even the homeless have had more violence against them. People believe that people who don't look like them are more likely to infect them with this. And so it opens up, unfortunately, some violent tendencies of other people against people who don't look like them. Unfortunately, because of the socioeconomics of these people I take care of, because they have less resources to be able to shelter in place, and they have to go and get food, and they have to go places to get some of the things that we're able to receive while at home, they have been more affected. And so the local health authorities, you can be reassured, have tried to deploy more resources to help keep infections among the homeless and other groups where people have to live in congregate settings, such as nursing homes and other places. The county, your local public health services will deploy more resources to help fight the infection in those areas. Don't take it out on these people. If you see violence against people, that's an absolute horror. And for us to devolve into really the misery of believing that it's okay to hurt someone else because you think that they're infected is just, it's heartbreaking to me. And I've heard so many stories and been grieved at the violence against people who are minority or economically disadvantaged, like the homeless.
So one of the really important lessons that we can impart to our children, both as an educator, but also as a mother, is the ability to recognize when this happens, to recognize it as wrong. And I think you really eloquently explained why it's wrong. Someone's health is not a reason to discriminate against them. It's a reason to provide them with treatment and resources so that they have access to the same rights that we all do. But some of the terminology that we use in education is the difference between being a bystander and an upstander, right? And bystanders see it happen, but choose not to act because they're afraid to either end up having some of the anger or discrimination turned toward them. And an upstander is someone who's willing to step up in some way and speak out against the undue discrimination so that others are able to access what they need. What advice would you give to parents or educators as to how to talk to children about what they're seeing? Because surely children are seeing this. And how can we as adults model being an upstander under these circumstances?
You know, I think there are a lot of, depending on the age of the child, different ways to share with them on how to love their neighbor. And I think of the stories when my children were young about there's a story that they shared, I shared that people would go through society and give dots if they were someone that they didn't like, or stars if they were someone they liked, and all the people with stars were respected in society, and people with dots were dejected and rejected. But then there were some people who were relieved of having the stars or dots stuck, and those people walked around with the self-confidence and pride of being themselves. And so stories like that I think you can share with young children, older children. You can, I think, engage them and help them understand the underlying experience, and if they can empathize with people who are lesser economically advantaged, and understand the challenges that they have. I know my own son has been part of in his high school called a small cohort called the Social Justice Program, and they can understand the pressures that people who are economically disadvantaged, and also stand up for them by speaking out to support them, and to understand the policies that are in place to protect them, as well as the programs, social service programs that are available to these people, and to encourage people to support them politically and not fight them, because I know that many of those we're seeing, for example, our Medi-Cal, which is our local state healthcare insurance provided to low-income individuals, there's going to be a loss of many services. And so being an advocate for continuing services to the economically disadvantaged will be important.
One comment before Kerry asks another question is, I think about you and other healthcare providers, and when somebody walks into your clinic, you don't ask them what their political views are. You don't, their race and their age and their economic status doesn't determine what kind of care they're going to get. And when I think about this idea of discriminating, or even worse, harming people who you think might be infected because they are in a certain group, what we need to do, it strikes me, is first of all, keep our social distance from anybody. I mean, I'm going to stay away 6 feet away from someone, whether they're Asian or African American or Caucasian. It doesn't matter if they're a human being, and I'm going to stay at least 6 feet away from them. I'm going to encourage them to get whatever health care they need, not only because it's good for them, because that's the right thing for me as a human being to do for my fellow human being, because it's good for me. Because if they're getting the health care that they need, whatever race or economic group they're in, the safer I am. And I'm sure that fits in with your medical expertise.
Absolutely. It helps the public health and lowers your risk if everyone in our community can receive the health care that they need to stay well. This disease does not discriminate, and you're at equal risk if you come within 6 feet of somebody who has it, and you may not realize because they're without symptoms. The more we extend healthcare and support to everyone in our community, the more that you're safe. And some of that is not only an economic thing, where if you can encourage people who you know are disadvantaged to go seek out their free county health resource, places like mine that can see you for free and get well or stay well. That'll help the general public health. It also is actually the kind of care, concern, and encouragement that you can give to people who are too afraid to seek care. So people with insurance are not going to seek care because they believe that they're going to get COVID from going to the doctor, going to the hospital. And so in the emergency rooms, we're seeing people who've already had their heart attacks or strokes, and it's too late for us to help, or had their appendix burst and come close to death because of the spread of bacteria to the bloodstream. So people are seeking care too late. And if the more that we can encourage our loved ones to actually talk to their doctors earlier when they're feeling poorly, and not worry that they're going to get it, because we can protect them if they have to come in. I think people don't even talk to their doctors about minor things that they would otherwise have talked to the doctors about because they're worried that their doctor will tell them to come in and not be reassuring. We're going to be reassuring. We can do it over the phone or video. Your physicians would be available to you to reassure you. And only if we really find it very necessary for you to come in would we ask you to. I think people feel that their doctors will be overcautious and ask them to risk exposing themselves by coming in to get lab tests or radiographs. That's not the case. We're healers, and we would try to be as reassuring as we can over the phone.
And by the way, that was my experience. I think I might have mentioned I broke a tooth. So I didn't know it was broken. I spent 2 weeks constantly texting my dentist, putting off, postponing, but finally making the decision to come in. But he was incredibly supportive of my concerns about not wanting to be exposed. And then, of course, his office went through every possible procedure to greatly minimize the risk to not only his staff, but to me as well. Kerry, I think you had an interesting question you wanted to bring up.
Yeah, this is switching gears a little bit, Enoch. There's a lot of mixed information out there about the timeline for a vaccine. And we're hearing mixed information coming from, overseas, from China, from various labs that are doing research in Europe. And then we're hearing from leaders who are not medical experts that it may be by the end of the year. And then from others are saying we're hearing 12 to 18 months. I've heard as many as 3 to 5 years. What is it that we should have as a reasonable expectation for a vaccine? And then once the vaccine is created, how long will it take to produce it in amounts that will allow people to actually get vaccinated?
It's hard to say. We'll know when it's available, and it could be some time. So in the meanwhile, I want people to have the reassurance that if you follow your guidelines, national guidelines on how to stay safe by the social distancing, the hand washing, the wearing of masks, and take hope to see that internationally in Asia, they're successful in having very low rates of spread of the disease because they're abiding and they're listening to their authorities, and they're places that people are just more obedient. They just are willing to follow those directions. If we can do that,
Americans, huh?
I know
that rugged individualism.
Yes, it's good to be an individual. It's good to be self-sufficient. It's good to claim and be strong in our ability to improvise and innovate. But it's also important to be alive. And sometimes some of those natural American instincts go against the control that they feel that federal and state and local guidelines make against them, and they want to liberate their areas. You're only liberating them into possibly exponential spread of disease, hurting many of you who are returning to bowling and to gymnasiums and other places that are not well protected.
A parallel, we have to wrap up soon, but I want to ask you about herd immunity, because an argument is made that it would be good for young, healthy people to go out in public and maybe even get the disease because they would help create herd immunity. What can you tell us about herd immunity in terms of both its potential to protect some of us, but also the danger that it brings if we go out and deliberately take risks to create herd immunity?
Well, you can see internationally that Sweden has taken that tact, and so they have 10 times the rates of illness of the surrounding countries that have been sheltering in place. It is a different strategy. It is a strategy that we eventually will attempt to have when we have a vaccine. But to do it currently with some people having COVID parties by finding someone who has the illness and deliberately sharing secretions with them, that is insanity, because we don't have the hospital and public health infrastructure to support an overwhelming number of people ill. We've, in our area, squashed and quashed and completely flattened the curve. So we have quite a lot of capacity to take care of more sick people. And so that's why you have started to see the ability for us to relax some of the controls of sheltering in place and returning to the next stage of opening up our society. The idea is that eventually we will get there with herd immunity, but we need to get there in a way that doesn't overwhelm the resources that need to be available to help you if you get really sick.
Well, Enoch, Kerry, I'm sorry, go ahead.
No, I just wanted to say thank you so much for this information. I think that it's been really helpful, and I really appreciate that where you don't have definitive answers, you really drove people toward, moving forward. What we do will depend on the data that we get and the recommendations of the authorities that we should pay attention to. So I think your clarity is really important during this time.
So we usually run this show about 35 minutes, but for a lot of reasons, I let it go longer. Part of it was because of the great medical and social information Enoch was giving us, but part of it was also the compassion. During the past 50 minutes, I've actually been moved a few times. I mean, I mentioned earlier, sometimes I succumb to fear. Well, now I'm succumbing to love and compassion. And I really, I think that, that goodness is contagious as well. And I want to thank you, Enoch, for sharing that with me. And I think I caught a little bit of it, and maybe I'll have a better day as a result of it. But I just want to thank you so much for taking the time. Kerry, as always, I want to thank you for your great questions. And as I mentioned earlier, this is being recorded. So if you know somebody who missed it or you want to watch it again, it's going to be on Connect Safely's Facebook page. It'll be on my Facebook page, Larry Magid. It'll be at ConnectSafely.org/live. So you'll have plenty of chance to share this video. And I urge that you do, because I think that we got some information today that you're not as likely to get from national news sources, certainly not with the depth and with the compassion of our guest, Dr. Enoch Choi.
Thank you so much. It was such a blessing to be able to be here and to share. And I certainly am going forward with this day really with a heart full of love of what you've just shared with me. Thank you. That means a lot. It's very touching.
Thank you so much.
Thank you.